Hi, I'm Dr. Chandana Lakkireddi. Today we'll talk about endometriosis and how it could affect fertility. As you can see, endometriosis is a condition in which the menstrual blood usually spreads outside the uterus, like around the ovaries, on the tubes, and sometimes in the area all around the uterus and ovaries, which is called pelvis. When we see endometriosis in the ovaries, it is called endometrioma. So how it can affect the fertility? Endometriosis affect fertility in various ways. One is it might reduce the egg number, it might reduce the egg quality, it might affect the tubes. So by this, there is a less chance of natural conception. And how we grade the endometriosis? It depends on how it is presented and how much it is spread. There are mild endometriosis, moderate and severe endometriosis. Women who have mild endometriosis usually have less symptoms and they might conceive most of the times naturally or with minimal support from the fertility experts. Most often when we diagnose this problem, we look into the other fertility issues and we might start her on ovulation induction and doing a regular scans and helping them to conceive naturally. When women have moderate to severe endometriosis and also when she have lot of pain related to this, when she is suffering with endometriosis, the best option for them is to go for the fertility treatments. So if the size of the cyst is big, if she have severe symptoms, the first treatment will be removal of the endometrioma from the ovary and also release the adhesions which are present in the pelvic area, so that the pain will be settled, followed by plan to pregnancy sooner, because there is always a chance of recurrence of endometriosis. So we would rather ask her to fall pregnant sooner rather getting into another endometriosis episode and going for a repeat surgery. So there are few women in which because of endometriosis, the egg number would have already come down, whether it is related to the disease per se or could be related to the surgeries which were done before on the ovary for the same problem. For them, what we would suggest is, because of the tubal issue, because of severe endometriosis, they would rather go for the most successful treatments, which are IVF treatment, in which we preserve her fertility. So if she is an unmarried girl, we preserve her eggs, and if she is a married woman, we preserve her embryos. Later, she will go for the surgical treatment and clear her endometriosis, clear the ovarian endometrioma, and if there is any effect on the uterus, she will go for the clearance of that, and then she will come back to us for the embryos or the eggs to be utilized and to fall pregnant. This is the best approach in which woman will not lose out on her fertility. We are preserving her fertility. Her symptoms are tackled well in the surgery, followed by falling pregnant in a very smoother way, so that when she conceives, most often there is a chance endometriosis might get suppressed as her periods will be stopped. So whenever an endometriosis is detected, when we are trying for the babies, there are various modalities available. So you better meet a multidisciplinary team in which there should be an infertility specialist, there should be an gynec endoscopic surgeon, counselor. In all these people together will assess where you stand, which treatment option will be best for you, and accordingly when we treat, you will be having the best success. Thank you and all the best.